So Briar Stewart is right there at the Vatican. So Briar, can you tell us what you've been seeing, what you've been hearing?
Well, here in St. Peter's Square, Adrienne, a few thousand people gathered to pray for the Pope's recovery. And the latest update that we are getting from the Vatican suggests that his health has slightly improved. Now, we have to remember that he is 88 years old. He remains in critical condition and he has pneumonia in both lungs. He's also still on oxygen, but doctors have been able to reduce the amount that he's receiving. And he does have mild kidney failure, but officials say at this point it isn't a cause for concern. Now, what is significant is that since Saturday, he hasn't had any more respiratory crises, basically an asthma attack. And that is significant. But this is all being said. I mean, it's still a very serious time. Doctors say his condition is severe. This is the longest time that he has been in the hospital, but the Pope seems determined to keep working. And in fact, Adrienne, he had a call with the only Roman Catholic parish in Gaza today.
So, Briar, I understand that there was a crowd gathered there earlier in the night to pray for him. And is that going to happen nightly now?
It is. It's going to happen every night until officials say the Pope recovers. And we were here as it got underway. There were a few thousand people in the crowd. There were a number of families and also members of the clergy.
We are worried. We are worried because this time he could not make it. And we are worried, obviously, for the Holy Father. And we come to pray.
We as priests feel especially that sense of responsibility and connection with our shepherd. So it's important to be here tonight and share that moment of prayer with one another.
Now, normally every Sunday, the Pope delivers a public prayer from one of the balconies in St. Peter's Square. This was the second weekend that he was unable to do that. Instead, he thanked the public for all of their support and prayers.
All right, Briar Stewart at the Vatican. Thanks, Briar. Now, along with those prayers, Pope Francis is getting high-level medical attention to try to deliver him through his illness. Jennifer Yoon asked Canadian doctors what he's up against.
Hospitalized for over a week now for Pope Francis, the crucial battle is in his lungs. Vatican doctors say the Pope has a polymicrobial respiratory tract infection. In plain language, there's a growing mix of bacteria, viruses, fungi, or parasites, and it's affecting both of his lungs. He's been prone to lung infections since he was a young man, when the lining of his lungs became inflamed and part of one lung was removed. The Vatican says the Pope is receiving oxygen therapy.
With a device called high-flow nasal cannula, which is a breathing machine that delivers very high flows of oxygen through the nose. It helps the patients when they're tired, so they get a little bit more rest.
Vatican doctors now say they're reducing the oxygen flow.
The fact that his oxygen is decreasing is a wonderful sign that he is improving.
But doctors say there's still cause for concern. The Pope's kidneys are in trouble. The Vatican says they're sustaining damage and possibly at the early stages of shutting down. But the damage can be reversed, says this kidney specialist.
With the right types of treatment, antibiotics, other types of supportive treatments that we can provide in hospital, even if somebody does have mild kidney injury, it can recover.
But some are warning, even if he recovers, it may not be easy on his body or his mind.
Can people as frail and elderly as Pope Francis recover from such a condition? The answer is yes, we've seen it. At what cost? There's always a cost.
Vatican doctors are still being guarded about the Pope's prognosis. They say the situation is too complex, but also that there are positive signs. Pope Francis is reportedly awake, in good spirits, and eating. Jennifer Yoon, CBC News, Toronto.